Hello and welcome to another podcast from Odell Technology. Today we're joined by Kavita from Word 360. Hello, Kavita.
Good morning. Nice to meet you.
Nice to see you again. Hello. Kavita, can you tell me a little bit about yourself, please?
Yeah, sure. So my name is Kavita Parmar. I'm the Chief Commercial Officer and founder of Word 360. Word 360 deliver language support into the NHS and into healthcare. Predominantly, we're supporting people with language barriers, communication barriers, whether that's the inability to speak a specific language or sensory loss, so hearing loss. And we do that through our technology called WordSki.
Okay, so tell me, Kavita, tell me a little bit about your background. How did you end up where you are today?
Yeah, good question. So I was actually an optometrist. So I qualified as an optometrist when I started my career. I won't go into why I became an optometrist, but I ended up becoming an optometrist and I practiced for about 11 years. And within that time, I worked not only in private practice, but I also worked in domiciliary care, so in hospitals, nursing homes, so on and so forth. And I always had this burning desire to work for myself. So I was a locum then, and I felt like I wanted to go out and break out and do my own thing. So I dipped my toe in a number of different businesses. I had a clothing company for elderly and disabled people that was hugely successful, but I'm not a designer and I can't manage clothing companies. So I went back into optometry for a short while whilst I had my children. And then this opportunity came up. And you know what, Stephen, it was about one thing that I really center around is helping people. And this, in terms of providing language support, was an opportunity for me to really drill down into an area where I've come from, which is healthcare, and around supporting people with language barriers to really get the kind of care that they need. So
Okay,
that's kind of stemmed from it.
all right. So tell me a little bit about Word 360. You're the founder.
I am, myself and my partner are both co-founders. And we bought the business in 2013. And when we first bought the business, it was a small backstreet interpreting agency with 4 staff. And we basically used to provide interpreting into a local hospital. And everything was on black books. It was like ledgers and Excel spreadsheets and Access databases. And we're like, well, this isn't very scalable. We need to do something about this. And so on the back of a napkin, um, one Friday evening, I was like, well, why don't we kind of create a system that automates it all? Now, as much as I know about optometry, I know little about clothing. I know even less about technology. So I basically went into Europe. I went to Poland and Romania to find a company who would be able to build some tech for me. And they built me a prototype that essentially is like an Uber for interpreters. That's how I'd like to look at it. So it was talent matching the 450 different languages that we cover against the requirements of the clinicians, whether it be the level of qualification that an interpreter has, how close they are, whether they've got security clearances. And it would kind of talent match those different areas to the different interpreters on our books.
You do a lot more than you do a great deal more than just helping the patient. You also help the clinician.
Absolutely.
Okay, so
Absolutely.
how
So
does
it's
that
about
work?
so it's about making sure that we are assessing and making sure we're collating as much data as we can about what that clinician needs. So, is it that they need somebody who's got some expertise in medical terminology? Do they know how to work with children? Do they know how to work in a mental health environment? Those are all really critical factors because clinicians will have a varying degrees of conversation. It could be complex cases, it could be end of life conversations, or it could be something as simple as talking about dandruff in a GP practice. You know, they need to have different levels of capability and expertise. We also work in medium secure units in prisons. So there needs to be that level of security clearance as well for some of those interpreters. So when you have all of those different prerequisites and you also have 450 different languages to choose from, you can understand there's a lot of variables and a lot of
Okay.
matching to do. So our system essentially does that, but then it takes it to another level, which is kind of spurred by COVID, really, around the digital transformation of this accessibility. So it's not just about having an interpreter turn up at a hospital or a GP practice. It's about how can I get that language support anytime, anywhere. So our system, WordSki, now allows you to not only book somebody to turn up at a practice, they also can be available by video and by telephone, and generally within 30 seconds.
Okay.
So now you've got access to any language within 30 seconds who have the level of, and they're clinically safe. So they've got that level of expertise and capability at their fingertips. So it's a frictionless service for anybody wanting to communicate with somebody with language barriers or sensory barriers. So we even provide British Sign Language interpreters.
Oh, that's quite handy. But tell me, they're actually talking to their equivalent in a different country?
They're all UK based. So
Ah,
protecting the sovereignty of data, it's really important that our interpreters are UK based. So, I mean, Stephen, we have very diverse communities. You know, you look at places like London, Leicester, Birmingham, they
yes.
are diverse communities. So that talent pool exists. And so having that talent pool, harnessing it, we have our own academy where we upskill and train linguists as well. So we're creating this ecosystem of language that enables us to serve our customers.
And how many languages did you say again?
We have access to 450 different languages and dialects, but actually how many are active? To give you an example, last year we delivered about 147 languages across the UK.
Wow. Okay.
So a
So
lot.
can you give me any interesting case studies that you've got that you can recall?
Um, we provided Ukrainian interpreters. So when the war broke out in Ukraine, you'll know that a hospital was bombed, a children's hospital.
Yes,
And
indeed.
one of our clients is Birmingham Children's. And so we were able to mobilize 4 Ukrainian interpreters within 24 hours to receive those children at the Birmingham Children's Hospital when they landed and provide them with 24-hour care with
Wow,
interpreters.
amazing. That's a great story. I love that.
Mm.
Okay. So tell me, if someone from the National Health Service or from a community healthcare service wants to engage with you, how do they go about it? How does the model work?
So there's a couple of different models. So we have, depending on where you're based, you may have a high demand or a low demand. So we need to be agile to that. So we have subscription models where people can kind of pay as you go and they just pay a monthly subscription. The advantage is the system, the software. You want to be able, you want your teams to be able to know how to access an interpreter when they need one. They may not need one for 5 weeks, and then the need arises, and you're like, oh my God, what do I do? And having WordSki available to go, okay, I just need to go to WordSki. I need to request an interpreter in Romanian tomorrow at 10 o'clock. They punch it into the system, it automatically books it, and they get a confirmation to say that an interpreter has been booked. We
Okay.
have bigger, larger NHS contracts where we are delivering to something like University Hospitals Birmingham, where they will do sort of 3,000 bookings a month. And they
Yes.
will have a range of services that they'll access, whether that be translation of letters, whether that will be providing face-to-face interpreters, telephone, video, the whole suite of services that they need to make sure that they deliver an accessible service to their patients. And they're
What?
mandated by that as well. There's the Accessible Information Standard that is um, a an act that NHS organisations have to abide by.
Okay. Does the system in any way integrate into any other systems in the NHS?
It does. It does. So it integrates into EPR systems, it integrates into your patient engagement portals. So again, we're creating that symbiotic relationship where you book an appointment for a patient and it's tagged that they need an interpreter. It automatically informs our WordSki platform, and interpreter is booked.
Okay. What about prescription system?
Yes, we can do that as well. So being able to translate the information, the guidance on how to translate information so that people know how to take their medication, what they need to do, when they need to take it. We can do that labeling as well, but also to be able to integrate into your EMIS systems and your GP practices as well.
And what about surgical consent?
Yeah. So that's a really good one because depending on which medical director you speak to, they've got a different view on it.
Yes, they
And
do.
and the short answer is yes, we can. We can absolutely integrate into that, but whether that is a direction that the medical director wants to go in is a different question. But
Okay.
the ability to have that is the way that the whole NHS and the way the whole medical system is working. You need to be frictionless, you need to be seamless. And, you know, language is something that is a big barrier. Communication is the first barrier to getting the patient outcome. If you can't communicate to the patient what they need to do, whether they consent, you can't move forward. So, how can we break down that barrier? Giving information in an audio format, giving information in a written format
Mhm.
allows people to do that.
Okay, fantastic. All right. Now tell me, how long has the business been going?
So, we are entering into our 11th year.
Okay, and how many people are working inside the company?
So, we started off with 4. We're now on, I think the last time we counted, we're on 59.
Fantastic. And what are the plans for the future?
So one of the things that we were really particular about, and I think me personally as well, believe strongly is customer service. It's about making sure that the service user gets what they want. It makes sure that the clinician really gets the kind of level of service that they need. And so as a result, we didn't grow massively over the last 11 years. We wanted to hone in on that skill, making sure that the customer service is second to none, making sure that we really understand our client. And we've done that. We're the largest supplier in the Midlands now. We deliver to all of the NHS across the Midlands and to a lot of the local authorities as well. So after that, we've started our national expansion plan that started last year. We've just set up services across the whole of Gloucester ICS, Bristol ICS, Somerset ICS. So we're already looking at larger support models and creating community-based interpreting and language services that are dealt from an ICS level where we're creating significant data insights. But then we've already had interest from America, from Europe around how we can take that model into those countries because
Yes,
it's quite unique in terms
it
of
is unique.
in
Yes.
that healthcare space, especially.
All right. I have seen some models where people take a tablet up to a patient
Yeah,
and,
have
and
that.
that's done. I've seen that locally in London, but that's not what you do. You do something larger than that, don't you?
We do. We do have our own word ski on wheels. It's called the
Yes.
wows. So we do have those. Um, but it's about making sure that that we are almost having a buffet of language as a way
Mm.
I like to see it is the fact that a clinician, a member of staff can say, actually, what's right for my patient? And I can make an informed choice, whether it's
Yes.
having word ski on wheels on a tablet and I can access an interpreter in any language in 30 seconds on their bedside, or whether
Yes.
it's I can pick up the phone because I'm out in the community and I need to quickly get an interpreter. Or is it
Mm.
that I need to get my patient letters translated in my top 20 languages and I need the data to be able to do that every 12 months because my local demographic changes. There's different levels and there's different depths as to how you can go into supporting language, and we have that intelligence, which is what we're bringing into our service provision now that didn't really exist. The agility of knowing your community, knowing your local data and demographics in real time, and delivering
Okay.
a language solution to provide for that.
And you also do services outside of healthcare. Tell me something about that.
Yeah, so we do work with local authorities, we do work with central government. Fundamentally, we work in regulated industries, Stephen.
Mm.
That's what we do. We work in areas where you don't just need a chat, you don't just need a Google Translate. You need to know that the translation that you're getting back is assured, that it's been tested and vetted and it's done in a high quality standard. And that's what we're delivering. And there's a number of different industries where that comes in, whether that's insurance, whether that's police, whether that's local authorities. There's a number of different environments that our services are needed.
Okay. And how is someone assured of the quality of language interpretation? Is there a standard?
There are a number of standards. There are the DPSI and DPI interpreting standards, but also we have our own internal audit processes that are
Ah,
so important.
that's important. So tell me about internal auditing.
It's about making sure that we have our finger on the pulse of all the different types of interpreting that goes on, making sure that we are evaluating that and sense checking it. So whether that be doing mystery shopper, whether that be doing drop-ins, whether that doing regular language assessments with our linguist teams and making sure that they're competent in different levels of terminology, whether that's, through our language academy, having continuous training in CPD so that people are upskilling at all times to know about different environments. For example, we work with Women's Aid and we work with Mind, and they deliver courses around vicarious trauma, for example. How do we handle that? Do we have decompression sessions before and after? It's all of that. It's that depth of why we specialize in healthcare, is because it's such a rich topic. There's so much to talk about. We don't want to be whole of market, really. We want to just focus in health and social care, which is what differentiates us.
Absolutely. All right. Well, I've really enjoyed our chat today. Thank you very much.
No
Is there
problem.
something that you'd like to finish on, just describing your ambitions for the future and what you're doing?
Our strapline is to make everyone part of the conversation.
Ah,
And
love that.
that encompasses our vision and our values. And I think
Okay.
being able to achieve that, be equitable, offering equity of access to all, would be the ultimate goal for us as a business.
I love that. Kavita, I want to wish you all the very best. I think what you've achieved is quite amazing. And so all the very best to you.
Thank you. Lovely to meet you, Stephen.